out there. I just wanted to give the most up-to-date information very briefly because I think what I'm going to say is going to answer some of your questions perhaps, and it may instigate new ones. I don't know, but we'll see. So you were asking about the total number of cases in specific sectors. This was actually yesterday's information because we had to run it by Tallahassee, so it's a day after. But I actually have the information from this morning. 174 new cases that came in overnight, which puts us at 1,870 Florida resident cases that are Escambia County residents, and 370 non-Florida resident individuals who got tested here. Age range, as you can see, 0 to 105. Yes, we have some centenarians,
Centenarians.
whatever the word is that are in our long-term care facilities who have tested positive. And for some reason, we don't know why yet, and it's just mainly in Escambia that I've noticed is there are less men than women are getting the disease here. It's not the same across the state. It's about equal across the rest of the state. Okay, so this one goes to the number of cases. As you can see, a couple of weeks ago, we were at 23 positive cases. We hit a peak of 191 on 6/29. I am going to cough every once in a while because of my allergies, which are kicking in right now. So I'm just warning you, I am taking cough drops, but it doesn't seem to help a whole lot.
Oh, we're good. It's just all the people behind you then.
Yeah. Hopefully everyone's got their mask on, but maybe not.
Dr. Lamb,
So-
just to clarify, the cases are it says Florida residents, so I know
Yeah,
that.
these are Florida residents.
So I know that on 6/29, I think we had 250 cases as reported in the news, but 59 of those were non-resident cases, and that's why we're seeing the difference in the numbers, is that this is a chart
Absolutely.
of resident
Yes.
cases. So-
Other than the UWF location and our health department location, I believe the other 3 or 4 locations, being community health and the 3 hospitals, will test non-Florida residents. And of course, the hospitals receive patients from, Escambia County, Alabama, Baldwin County, Alabama, and they test them clearly before they come into the hospital or as they come into the hospital. So that's where we're seeing a lot of those numbers. Median age, as you can see, for the past few weeks has been in 20s, low 30s, one outlier there, 51. But we're seeing over the past 3 to 4 months a definite decrease in the age from where we had the long-term care, and I'll show you those numbers in a second here, in the 50s and 60s as the median age. Median is at the 50% point, so there are 50% of the people greater than whatever the number is. So if you pick 28, for example, or let's pick 31 for a day or two ago, that means there are 50% of the people are above 31 and 50% of people are below 31. So there are a lot of people less than 31 in that age range. And we've seen, as I said, a decrease in that median age over the past 2 to 3 months, and an increase in the number of teens and 20s and 30-year-olds getting it after when phase 2 came in and there was more mingling and things going on. So, okay, we'll get to testing in a second. So the median age definitely is lower than it was originally. Okay, so this is just an update on the number of hospitalizations, 94 as of yesterday, 44 deaths. We're actually up to 45 deaths today. Statewide hospitalizations, long-term care, this is an interesting number here. Long-term care cases, 344 out of the 1,870 positive cases, and at a percentage of 20%. 2 months ago, this was 45, 48%. So we've gotten pretty much under control the issue in the long-term care facilities. And that issue was individuals, staff members and non-staff members coming into those facilities who are not abiding by the PPE rules and who may have been symptomatic or not symptomatic and pass the disease to the individuals who are the most vulnerable, those of us who are above 65. I'm 66, I admit to it. And that's what the problem was with the long-term care. Now, a couple of weeks ago, the Secretary Mayhew put out an executive order, Mayhew from ACA, requiring that every 2 weeks, all of the staff, which probably they think includes the non-staff contractors coming in, they have to be tested every 2 weeks. So if we can keep control of, if we can monitor the number of staff and contractors by, every 2 weeks doing testing, I think we can mostly keep the disease out of our most vulnerable population. 95% of the deaths that have occurred have been in individuals over 65 years of age.
95?
Yes.
Wow.
So yeah, if the younger folks you have to worry about the disease, obviously, because if you have underlying problems, heart disease, asthma, issues, diabetes, cancer, HIV, you're at a higher risk. But most of the deaths occur in senior citizens. Now, but our death rates across the state are down because senior citizens know about this. They don't go out, they wear their masks, stay away from sick people. And so the actual death rate in that population is decreasing, that greater than 65 population. I think Chief Powell's going to talk about correctional in a bit. We have had 18
Dr. Lanza,
cases.
Dr. Lanza, when you talk about hospitalizations, what's the availability of beds in our hospital now?
Right.
I know.
I'm glad you brought that up because I checked with, and I put it on my little sheet here, I checked with all 3 hospitals yesterday and today, and all are still green. We worked with Mayor Robinson on that green insignia for the hospitals, which means they're not
You may go ahead
having
and explain, because
significant-
I'm familiar with the green,
Yeah,
but I
it's
don't
the
know if my
green,
colleagues
the
are.
yellow, and the red. Green hospitals are working fine. They have plenty of beds. They have plenty of acute care beds. They have plenty of ventilators. There's not a shortage. Yellow would be getting to the point where they're starting to worry about availability of acute care beds and generators. And then red, everything's filled up pretty much. It's green. It's pretty much always been green.
So it's just untrue, and I just want to make sure that we have complete clarification. It's untrue that there are only 3 ICU beds left at a particular hospital, right?
Well, if I may answer that.
Yep,
So
fine, no.
there's an ACA website you can go to. It's actually showing that there's 6. Now, were there 3 beds available last night? Yes, but we have a surge plan. We had, I think it was 330 beds available. You can turn a bed into an ICU bed.
Correct.
I think, if you want to say we're down to 3 ICU beds or 6 ICU,
Well,
how many do we normally have?
Exactly.
Hospitals try to operate at capacity. There's usually a somewhat of a wait list. So I think the bigger question is how is this different than, say, a year ago?
Exactly.
Well, Commissioner, I don't, with all due respect, I don't think Commissioner May said that. I think Commissioner May was asking for what was said in the media. I don't think it was
right.
I don't think it was his statement.
No, I'm not saying it is. I'm saying I looked when I sat down and then we had 6 beds available in the county.
Right.
But I'm just saying for everyone else,
Right, and
know
the
it's
reason
what
I
I
asked the question, because that was put out in
Right.
print, and so we need clarification.
And we had,
so if that is a misunderstanding, then that clarification should be conveyed to the general population, because the average citizen that I represent doesn't understand when they say that there's only 3 ICU beds.
And I believe there were some comments that may not have been highlighted as the title to the article was, but at least from Gay at HCA, that they normally operate at a very high percentage
Exactly.
utilization rate.
They have to
Historically, 90% or better. That's a normal thing. So, that's not like a lot of the things that get set up here or other places. Some things make better headlines that don't actually have a lot of substance to them.
Right.
So,
Right.
So, we have over 150 ventilators available.
Yes.
That was something we were worried about before. And so I think and that's why the hospitals are still indicating a green status, because there's availability of beds, there's availability of ventilators, there's availability of supplies, which is all things they were worried about back in March.
And that's why the marketing and money is so important, Robert. I understand the yellow, the green, and the red because I'm on a weekly call. Staff that gets paid money who work in public safety, they understand this. The average person who works in community and their parents are in a nursing home, they don't understand that. They don't understand when you read in the paper that it's only 3 beds that are available. That causes stress, that causes anxiety, that causes anticipation. And so we do have a responsibility to get the information out accurately. So you know how to go to Aqua, you're a county commissioner. The average citizen is not getting that information. So it's critical that we put out the information as factual as we know it.
And may I interject, please, for a second, because that's one of the discussion points that we had with our 3 presidents yesterday on my coffee. What people want to know when they see the media headlines and these salacious front page covers and things of this nature, they're thinking we're being overrun like Houston or like New York was a couple months ago. What we really need to see is, of the total available beds, broken out, how many are COVID patients and how many are non-COVID? Of the ICU beds, how many are COVID and what percentage, and how many are non-COVID and what percentage? We need that information broken out and put on a dashboard for citizens to see. Because if you rely on the media, they're going to play this up because that's how they make money. They like it to be a very, very, chaotic situation, and they like a lot of urgency. But I want clear data. And I asked that yesterday, and I didn't really get a good response. So I'm hoping, Janice, between what's out there, is that kind of information available somewhere so that the staff could go get it if the hospitals didn't want to provide it? Because that's important. We need to know that. I want to know. I asked them percentages. They said, well, we think 3%, 5%. They didn't give a good answer. Citizens want to know how many of these beds are being used by COVID patients. And like Robert said, how does that compare overall to last year? That's the kind of data that I'd like to see.
And Jeff, and I concur with you. I remember sitting here on this dais 2 months ago, and it's not that serious. Let's open up the beaches. Let's go. And all of a sudden, we're better than anywhere in the state. All of a sudden, we have people waiting in line to get tested 4 to 5 hours.
Sure.
The problem is we know that deaths and the critical part of this follows 3 to 5 weeks after people are tested positive. So, I mean, there's a lot of anticipation on people, not only if they get COVID, but if I break my leg, if I fall off a house, if I have a car. I mean, the hospital beds are taken, they're taken no matter what the ailment is. But we have a responsibility to report the truth.
Yeah.
And people can take it and receive it however they want to receive it. But it's up to us to make sure we get that information
But the
out.
truth has to be the truth. It can't be, well, look, we have no ICU beds left. Well, that's because we strangled the hospitals and told them they couldn't do any medical procedures that were non-emergency. And so they lost a lot of revenue. They had people laid off. I mean, so now they're back to doing heart transplants and things of this nature and these complex surgeries. And so, yes, some of the ICU beds are because of that being utilized. So,
And the good thing about it, we don't know the answer. And
that's why I want it broken down on a dashboard so we can see it.
Yeah.
How many ICU beds for COVID patients? How many beds for COVID patients? And how many are non-COVID? And let's end the hysteria and put the facts out there. That's what we need to see.
So Jeff, I did get an answer from one of the hospitals yesterday that less than 10% of their ICU beds were COVID patients. I just checked the ACA website again. We do have 7 current beds available. Select Specialty has added a ICU bed. So right now there are 7 beds available. And again, we have to look at how many of those are COVID.
But Robert, wouldn't you agree it would be great for the citizens to know? They see the news, they see people getting wheeled out on stretchers, people getting dumped into trailer morgues. Wouldn't it be great to know exactly what the real story is? I mean, I know it's a serious disease. It is a serious, but tell us the real story and give us all the facts. Don't show us videos of Houston or Arizona or New York and then try and conflate that with what's happening here. Dr. Lanza, the total number of hospitalizations, correct me if I'm wrong, that's from March forward. That's the total, the grand total, 95.
Correct.
From March forward. Okay.
And Jeff, for me, I'll err on the side of caution and safety at the advice of a healthcare
course. Me too.
official. I mean, we're
Me too.
politicians that make policies. We're not in a position to evaluate, to project, or to present data. I mean,
But we need the data to
need
make
it,
our judgments.
and we need it from the experts. And
Correct.
then we can make a decision.
Yep.
I mean,
I agree.
we're politicians. I mean, we're not healthcare officials.
Absolutely.
Absolutely. And Dr. Lanza, you have more slides, correct? Okay. Commissioner Underhill?
Thank you very much. I'll make it short. The only redeeming factor of that article in the PNJ is how few people actually read it. I am absolutely with my peers with regard to it is our job to put out the data. And Dr. Lanza, we've been kind of, you and I have been kind of push and pull on that for quite a bit. I mean, there is the constantly reporting the number of cases is not the public policy rubber meets the road point. It is this. It is do the hospitals have the ability to handle where we're at? It's the fact that the hospitals are reporting every day that they're green. That's what the citizens need to know, and especially in my neighborhoods of limited resources, people respond to fear. And when we have that kind of information out, the only reason that an article like that can be put out there is because we are failing to put out the data that we should be. So along the very same lines of the discussion about, there should be one click to find out where I can go and get a test today. It should be one click to find out that citizens can be reinforced that our hospital system is not overrun. And so that's not on you. The data sets are. I mean, I'm still, Janice, I'm still waiting 2 days later for filling in those data sets that from the state EOC that I asked for. We shouldn't have to wait that long. The citizens shouldn't have to wait that long. It should be at the touch of your, one or two clicks into myescambia.com, and that information should be available. So I hope that our staff is hearing loud and clear, because I didn't hear anybody say, no, let's put out less information. I think all 5 of us at one point or another in this conversation have said, let's do a better job of that. So I hope that we all take that for guidance, and I hope, Dr. Lanza, that your team and the team in Tallahassee can enable and empower our staff to do that for our citizens. Thank you.
So I do want to clarify that,
Ms. Gay, can I just respond to you one time? I mean, all the citizens have, and whatever your opinion is, when the cover paper says, Escambia County down to 3 ICU beds, if I was the average citizen, I would be alarmed too. And that's why it's important to kind of get that information.
That's journalistic malpractice, what they
Right.
wrote.
But that's what the majority of people read.
Mr., I would just share that it
Janice.
is only 2 clicks from our website to all the testing information. You click on the banner at the head, at the beginning of our website, and then there is, all the testing sites are listed, and it is updated daily.
Maybe, Madam Administrator, maybe that's something that we should pay for, a banner, a banner ad on, I don't know if on the pnj.com or, WEAR.com, northescambia.com, whatever. If we paid for a banner click-through ad that made that readily accessible for citizens for some period of time,
I support that.
I think that would be a very valuable resource. I know that Commissioner May and I are not alone in the fact of receiving questions about where to get tested, and I'm sure, and I feel confident that with whatever number of people might ask me where they can go to get tested, there's a greater number that don't call or text because they don't want to bother us and ask where, and they just don't know. They just kind of go along and figure they'll figure it out sometime, but they don't want to bother asking us for that. So, but they don't really know where to go. So, if we paid for a click-through ad on some of those, the expense of that can obviously be covered by CARES. It can't be that tremendous anyways. It's not a permanent. It wouldn't be a permanent contract that would be there. But if we paid for a click-through to testing sites for the next 60 days or 90 days, I mean, the numbers of people that we're getting tested are very high. I mean, we're working through some number of our population, and hopefully numbers are going to get better. I know that's what everybody in the room wants. We want to have better numbers, and maybe within 60 days the numbers are better, and we can kind of cease having that click through. But right now, I think at the testing and the access to testing, I think, is at the forefront of everybody's concerns, and that would make it even more accessible.
So that is where when you click on our online and our banners, that's where you will go to. But I think what I'm hearing you say loud and clear is you do have to scroll down to find the test sites, so we're going to put them at the top.
And I think,
Well,
Mr. Chairman,
more, as loud and clear as that is, I'm saying let's put it on. Let's contract with those websites.
It's already there. That's what we've already put out. So when you click it, you're talking about with the.
no, he's saying with other media sources, with,
That's what I'm saying.
we have
all the
Northwest
ads
Escambia,
that we just
Independent News,
purchased.
Pensacola
Yes,
News
sir.
Journal.
All the ads that
So-
we just purchased online, when you click on that, it goes directly to that
Okay,
site.
so the ads, okay, and
Yes, sir,
that
that's
wasn't,
what we did this
and maybe that's part of the presentation later, or part of the, that I didn't
click through
understand.
for you.
So they're click through, so the ads that we're purchasing are click through and are
Yes,
gonna
sir.
take people directly to that data?
Yes, sir.
Well, then I think that there would be a lot of value on the face of it, saying, click here for testing sites.
There you go.
Because I didn't see that on the front of it, and
You
if
did
you
not.
didn't know to click on it, then you wouldn't know to click through for testing sites necessarily.
And then maybe we can also add a little thing at the top next to testing sites indicating when it was last updated.
It's updated, it's supposed to be updated daily.
I know, but it's
Make,
supposed to
you
be.
saying put the date and the time?
Just put the date up, just so that people know they are getting the,
Yes.
they know when that information was updated, so that it just reassures them that, because, you're looking at the Extension Medical Group Sacred Heart, it's showing Monday through Friday, or, things like that. Just something else, just show when it was last updated, I think could be beneficial.
Yes, sir.
And if I didn't necessarily know that you could click through to get to the testing sites, then I wouldn't count on the public to necessarily
Yeah,
know
I
that.
agree.
Yeah. And then, Dr. Lanza, out of the 174, how many negative tests did we get back?
Well, if you look at this slide here, it talks about by day the negatives and the positives. So as of 174, we had 721. That was on July 1. So we had yesterday 174 reported positive and 721 reported negative. We
Dr.
should just
Lance,
add on to that.
when you interpret this slide here, and this is one of my main questions for you today. So, how do you, as a medical expert, and paid to interpret the data, not just aggregate the data. My perception of say that March, April, that time frame, we were having what I perceive to be symptomatic people for the most part were the ones that were being tested.
Only, yes.
I think that's a fair statement. And then perhaps it moved directly into maybe asymptomatic, but more likely in a dangerous demographic where we expanded the testing in long-term care facilities and in places like that where confined spaces, more elderly people that may be more susceptible if they were positive, even if they were asymptomatic. That's maybe the first demographic of more asymptomatic people that we tested. Even when we did that, our percent positive rates were relatively low. And now we're testing, I think so if we had 700 something negatives and 174 positives, so that means we tested 900 and something people, or we had 900 something
900,
results come back.
It's results.
That's a pretty high number.
Yep.
I would think that the vast majority of those 900 were still asymptomatic, probably, or would you think half, or if you were just guessing?
I would be just guessing, probably 30%, 40%.
So you think
Really hard to tell.
still a decent
because
number of the people that you're seeing go tested have some reason to go be tested?
I would say probably 40 to 50% have a reason to be tested.
Okay,
There are two
okay.
places that I'm aware of that will take anyone,
Right.
which is UWF
Right.
and the Department of Health. The locations, as far as I know, you have to meet the criteria for testing.
One of
which
those
is basically
criteria.
symptomatic, yeah.
So-
Or healthcare worker or first responder.
So with still a pretty high percentage, even if it's half or even a little less than half, probably at least a third, if not half, that are asymptomatic, but our positive rates are still so much higher than they were. I don't, as a layperson, I don't understand how it would seem like the positive rates of the symptomatic people from March and April would have been much higher than the numbers that we see now, and that's what I have a hard time, kind of understanding. And there's not been any. I don't presume that there's been any type of change in the way that the data is interpreted, like the actual scientific data that's taken from people, whatever that is interpreted to determine a positive or a negative result, right? That can't have changed, right?
It's PCR positive or an antigen test positive, and I think now they're talking about even antibody tests presumptively positive. But back in March and April, remember, we're still in flu season, cold and flu season. So some of those positives were due to that, allergies and other reasons, and that's probably the reason the positivity rate for COVID was less.
Some of the symptoms, you mean?
Yeah.
Some of the symptoms were due to
Same
that?
signs and symptoms,
Okay.
basically similar.
Not
I
some of
should
the
say
positive,
similar.
not some of the positives were due to that, but some of the symptoms that people were feeling were due to
Right,
that?
we're due to that, correct.
Okay. So do you have an idea or any expert feedback for us as far as why we've had that change or why our positive rate is
Oh,
kind of-
absolutely. One, we're doing 3 times as much testing as we were 2 months ago, even a month ago. And with the opening of the restaurants, with the congregation of individuals together who are not wearing masks, or not social distancing, or not washing their hands, they are passing the disease around. That's what we're seeing. I mean, I was listening to the Fox News this morning, and they were talking about quarantine parties. They were talking about hurricane parties, they're talking about quarantine parties, in which the young folks are, and I'm just saying what I'm just reporting what I heard on the news this morning, was that they who would get COVID first, who would be tested first for COVID after the party. And that kind of not socially responsible behavior is what the problem is. If everyone was wearing a mask when they couldn't social distance, or just wearing a mask period, and social distancing and washing their hands, staying away from large congregate groups if you can't social distance, then we wouldn't be having this problem, okay? We've taken care of the issue in the long-term care facilities pretty much, okay? There's a couple outliers here and there, but it's got to do with social responsibility. Wear your mask, especially, obviously, when you're out in public. Wash your hands, social distance, and stay away from those large groups if you can't social distance. I mean, that's the basic premise here. Till we have a vaccine, that's what we have to go by.
Mr. Chairman?
One second, Jeff. So, you've heard, I mean, not the first discussion amongst us, and then the lengthy discussion today. What else, do you have some further advice for the board, some actions, some additional actions that we could take, or some more feedback for us by trying to work the percent positive rates down? I mean, that's what, the aggregate numbers are one thing, and they can certainly be alarming, but I mean, for purposes of how I feel personally about what is happening day to day, I try to look at what the percent positive rates are, because that seems valuable to me rather than an aggregate number. And that's what's been, very concerning the last week or 10 days. Do you have some feedback for us about that,
Well,
outside of what's been said?
I think what Ms. Gilley reported to you earlier, the work of the hastily put together coalition in Escambia County looking at this particular, the Mask Up Escambia project, I think is a way of getting social awareness out there, awareness to especially the young folks who feel, teenager, you feel like you're invincible. I mean, that's why you have driving accidents and those sort of things. I mean, it's the same sort of issue, I think, is what's going on. And anything that we can do to get the word out that this is a disease, you can get it, you can pass it on to folks who may not do as well as you will if you have the disease, such as your parents and your grandparents. That social responsibility, I'm not sure how we make people socially responsible. Wear the mask, social distance, wash your hands, don't go to work, or don't go out if you're sick.
Right.
Get tested if you're sick and you have the signs and symptoms of COVID.
All right, I'm sorry. And last question, Dr. Lanza. So the way the test results are interpreted, say that one of the young people, say that somebody that's 25 years old, they test positive, or say they they had the virus in March and were asymptomatic throughout it, and now they don't have the virus, but they have the antibodies from having the virus. Is that a positive test, the way that it's interpreted?
Good question.
Or is that a separate type test?
For the moment, it's being accepted as being presumptively positive.
Okay.
The problem is that there's a lot of good science on what a line on somebody's strip test is, the test we use for pregnancy tests and for strep throat. It's a strip, the line that indicates positive or negative. We're not really sure from one test to the next as to whether that really confers immunity from any further exposure to the disease. It's not quite there yet. There are some tests that are positive, but there's a lot of
So that's the reading of the test. It's
The
literally
antibody
like a pregnancy test. That's what's being, that it's just a line.
Right, with the antibody tests, the ones that are the fluid tests that are out there now that are similar to the pregnancy tests and the strep throat tests and the flu tests, give you a line, plus, minus, whatever.
Right.
And there are some that are approved by the FDA, they're antibody tests that we're using as presumptively positive, but there's a lot of them out there, and you have to know what one is being reported to the Department of Health to know if it's something we're going to accept or not. So
Is
there's a
there-
lot more work needs to be done on that.
Is there overall unison among the people that are doing testing? Are the interpretations basically the same no matter where somebody gets tested? Do we have conformity there?
Well, as in anything else, it depends on the goodness of the test. We could talk about false positives and false negatives and those sort of things.
I mean, do you feel
Each-
comfortable that at least it's structured to be that?
Yes,
at
the
least?
PCR
Okay.
tests, definitely.
Okay.
And there's another intermediate group called antigen tests, that they're probably going to be good too. The antibody tests, like I said, we just don't have a lot of science behind them right now, but they're working on it.
So are there a large number of say the 174 that we had today that that are positive? Is there a large number of that 174 that you think are composed of presumptively positive, that might be positive
No,
for
those are all positive.
Those are literally positive, okay. So that,
Because they're in our Merlin software system.
okay.
So we only report those that are positive. And there's a separate category for the presumptively positive.
Is that, I
Because
presume
they're antibody tests.
you've been tracking that, is that, whatever is going on there, is that going better than this? When you see the numbers on the presumptively positive side, that's not something that gets reported every day, or is that problematic currently as well?
That's something that just started from the
Oh.
Department of Health. So I
Just
don't-
started recently,
It
like,
just started recently.
okay, all right, I'm sorry.
Just
Thank you.
within the past week.
All right, thank you, John. Jeff?
Dr. Lanza, so when we see these numbers and we see the large number of young people, a question that I get from constituents and a question I've heard a lot, and I frankly am very curious for the answer myself, how many of those, and are we tracking, are asymptomatic? No temperature, no cough, no symptoms, they just came in because they were curious and, oh boy, they're positive. Is there a number, is there a percentage, and is someone tracking that?
No.
Why is that?
We don't monitor that because what we do is when we get a positive through Merlin, we call that person up and ask them a set amount of questions. And
Okay.
I don't think, what's your symptomatology? I don't think that's one of the questions that we ask.
I just think that'd be an incredibly useful data point to have because, we're seeing these numbers, we're seeing these young people, and obviously they're not crashing through the doors of the hospital. So, and I'd like to know, I mean, I know that my constituents would like to know how many of them were just in the car on the way to UWF and decided to go get tested. Oops, I'm positive. But more importantly to that, because I asked some questions yesterday and really didn't get a firm answer, maybe you can help me. We're not talking about the recoveries. We're talking about a cumulative number, and of course the media loves that. The bigger the number, it's just being very salacious. It makes for better headlines. But I'm very interested in recovery and what that looks like. So if you're a young man that tested positive in March, like Stephen Barry just said, when can you say, I don't have it? Is there a definitive line, or when you're recovered, does that mean you still might have it in your system? And if you still have it in your system, are you contagious? Can this person go back to work? There's a lot of unanswered questions that lead to a lot of confusion and then a
Right.
lot of
And there's very good guidance on that I have sent out repeatedly over the past several
I've read it. I'm
months
sorry, there's so much of it,
to
though.
the physicians and others in the community.
Give us the Cliff's Notes.
Yeah, basically, if you are positive, 9 days later, according to the CDC and our state epidemiologist, the RNA that carries the virus, the virion that is made up of RNA, you are not going to be able to pass that on to someone else.
After 9 days?
After 9 days after being positive,
Okay.
testing positive.
That's a
Yeah.
good answer.
So someone brought up the fact that there are people who are repeatedly positive. Yes, there are people who are repeatedly positive 2, 3, 4, 5 weeks afterwards. And that's because of the way the PCR is run. There are certain, it gets very technical, it has to do with something called cycling time. A higher number of cycling times that a PCR is allowed to go through, greater the likelihood it's going to pick up that sequence of RNA and call it a positive.
Okay, so if I'm recovered and I've had it, 9 days later, I can go back to work. I don't have to worry about passing it to grandma and my grandfather, my grandmother. I mean, I'm good to go.
Well, once again, depends on the situation. You'd have to be evaluated individually, but definitely after 2 weeks after testing positive, just as a general statement.
But I
for
hear about
people-
asymptomatic spread. So how does that square with what you're telling me just now?
Who's not tested or has been tested.
No, I mean, they're saying that asymptomatic people are spreading, asymptomatic community spread.
Right.
So I'm hearing about that. So how can that How does that happen? I mean, how can that?
How does someone spread it asymptomatically?
Yeah, if I have no symptoms whatsoever. and
Oh, okay, well, just speaking to someone, you put out droplets that somebody else breathes in through their nose and mouth, and it goes into the lungs, into the nasal passages, absorbed into the body, just as it would be with someone who's symptomatic. There's no difference.
And so someone who tested positive, but after 9 days, they cannot be someone who would be an asymptomatic spreader, or could they be?
They would not spread that to anyone else, whether they were symptomatic or not.
Interesting.
Because you could be symptomatic for an echovirus or another virus on top of the COVID, and you could still be symptomatic. You could have allergies and still be symptomatic, but you're not going to spread COVID-19 after 9 days.
Very, very interesting. So, but no one's asking at these test centers, or do you have any symptoms? Why are you here? And the percentage that are asymptomatic, there's no one keeping track of that at all.
So UWF and the Department of Health do not ask questions about whether you're symptomatic or not. They and us take everybody.
Wow.
The 3 hospitals and community health, to the best of my knowledge, do have a screening process.
Thank you.
Commissioner Bender?
Thank you, Mr. Chairman. Dr. Lanza, I appreciate the discussions we've had over the last few weeks. I just want to talk about a few things. One is our non-resident cases. Little Escambia County is second in the state in terms of the number of non-resident cases. The non-resident cases make up 17.3% of our cases, and these are going off yesterday's numbers, so they may be a little different given what just came through. And their positive rate is 13.7%. So, 13% come back positive. Our resident rate is 82.6% of our cases, and they have a positive rate of 5.77. Can you talk about, through the contact tracing that you've seen, these non-resident cases? So, I mean, there's thoughts that, there would be tourists that are coming here to Escambia County, but again, we're only behind Miami-Dade as the second highest non-resident cases. So we're not seeing in other tourism places, even along the Panhandle or Orlando or other places like that. So would you be able to talk to that for a minute?
Sure. You have to realize we have 3 tertiary care hospitals in our community: Baptist, West Florida, and Sacred Heart Ascension. They accept patients not just from the Florida counties to our east, but the Alabama counties, Mississippi, even going over to Louisiana. They have patients coming in to those 3 hospitals because of the services that they provide. Everyone that comes into those hospitals for surgeries, for example, is tested or just admitted is tested, because obviously they want to keep it out. So when you're in a situation where we're surrounded on 2 sides by another state, then you have to understand that a lot of the patients that come in there are from out of state. So that would explain.
And I think we had also talked earlier that we had people coming from throughout the Southeast because Sacred Heart was one of the first ones to have drive-through testing.
Yes.
And so there were, I think you said Tennessee, that were coming in just to get tested because again, hats off to our medical community and getting testing set up for us, but it also allowed other people to come. So I know earlier on, we had 20% non-resident cases that were coming through. When our total cases were around 1,000, it was about 20%. So that's one. The long-term care facility, you said, is at 20% now versus 45% where it was before, rough numbers. But that there were 344 cases. I guess as the number of cases spike, I would rather see the number, the hardcore, the data's number of how we got to 344 as opposed to a percentage, because as the number of cases increase from the testing, then ultimately that 45% would go down. So
Right.
I just want to be able to show in hard numbers how the numbers have declined in long-term care facilities as opposed to just saying a percentage, because data can be deceiving. So I also want to talk about the beach. So you guys do the long-term, I mean, you do the contact tracing, and we had talked a few weeks ago, contact tracing had not necessarily led back to what I'm going to say is the sun in the sand, as one constituent I emailed with the other day said. Of course, we did have probably some that lead back to the bars. I mean, I've talked to bar owners that said, yes, we knew we were going to get shut back down because we were exceeding the 50%. We weren't physically distancing. And so, and actually an interesting point that was made over the weekend was that the hot summer weather is actually sending people inside where we are seeing a familial spread or and things like that. So I just want to ask again, have you seen anything that's led back to necessarily the beaches being opened with a spike in the number of cases?
And I specifically asked my epi staff that on Tuesday, and well, the answer is no. We have not been able to see an epi link from going to the beach, just from the fact that you went to the beach. We have seen a link between going out to the island and then going to a bar or another location where you were around people where you weren't socially distancing and not wearing a mask, mostly in the younger population. We have seen those kind of links for sure, but just going to the beach and then, say, going home or someplace like that, no, we haven't seen any epi links. And I wanted to correct one thing that
Yes,
may
sir.
have misled you. We don't do the contact tracing on the non-Florida residents. When we find out what state they're from, the state of Florida then contacts the county that they're in and then supplies the county health department with that information. Then they do the contact tracing on those out-of-staters.
Okay, and I think that also, just to add on to that, of course, we're talking in numbers about how many Sacred and UWF are doing. That would include also Santa Rosa County residents that are coming over, but when they get a positive, that falls under their Santa Rosa County positive number. So,
Correct.
So when we're saying that we're doing 1,200 tests a day just from 2 sites, but we're only getting, say, 721 back, 300 or 400 of those could be coming from Santa Rosa County. So I'm just trying to, I'm not saying it's that high, but I'm just saying that
It's possible.
it's possible. But and that's why the number of what we're saying, number of tests that we're doing may not correspond to the number of test results that are coming back to Escambia County.
Yeah, you're
because
right.
that
Yes.
includes Santa Rosa and other
Yeah,
ones as
because
well.
as a government agency, we can't say no to another Florida county. We can say no to another state, but we can't say no to another Florida county. So
Sure.
yes, we test this, we'll test any county, we'll test Dade County.
Right.
People will come up here, right? For sure.
And then I want to also talk about symptoms. So it seems that we are having more asymptomatic positive cases. And as you said, partly due to that, hospitals are requiring a test before you have a medical procedure. So that's turned some positive results in that maybe someone wouldn't have gone to get a test. But I've also heard that some of the symptoms have been more linked to a sinus or a GI issue.
Right.
And that number, especially for the GI, was as high as 20%. So someone who just thinks they have a stomach bug, food poisoning, something like that, they go get tested because they have the opportunity to. So Janice, I think as part of our marketing campaign, I know we have what's listed as symptoms for that, and I think GI was down at the bottom. But I think as we start to see, and it sounds like we don't really trace the symptoms, but that we maybe update to let people know that, hey, your GI issue that you're having really may be a symptom of COVID and that you need to go get tested. Or just the runny nose. I think
Yeah, that
that's
just
what you
came
said.
out recently.
Yeah,
The
that
runny
just a
nose
runny
and the GI.
nose is a symptom that people are showing that have come back positive. And so it's not just the shortness of breath and the fever
Cough,
that we're
fever,
seeing.
yeah.
Of course, I think it's great that we're still taking those measures of taking temperatures and things like that, because it is an indicator, but you don't have to have those in order to have COVID. And I think the other thing you mentioned regarding the beach, and this is true for everything, we're seeing, and this was 3 or 4 weeks ago, where we were seeing a spike from carpooling. I know someone who rode in a car out of state with somebody else who ended up getting it. And so I want it to be very clear that this isn't just businesses that you need to physically distance and be careful. As you said, there are house parties, there were graduation parties, there are just riding in a car together. You need to be careful when in all of those situations, and not just when you may be out in public. And so, again, I think I would like to see that we do a better job of informing the public that they need to be vigilant in protecting themselves and following the 3 C's and wearing a mask and washing your hands all the time, and not just when they've been out in public.
Right, and as far as the carpooling goes, if you're in a car with non-family members, definitely wear a mask. You may not be able to stay away from the next person, depending on, the situation, but roll down the windows and put the air conditioner on. And therefore, you got all kinds of airflow, and then wash your hands when you come out of that carpool. I mean, some people just have to carpool because they have to work, I understand that, but try to be as safe as you possibly can while you're doing it.
Okay, all right. Thank you, Mr. Chairman, I appreciate it.
Yep. Commissioner Underhill and Commissioner May.
Thank you, Mr. Chairman. Dr. Lanza, we're starting to see a trend in some of the policy making for states, for travel agencies, and also with the federal government of if you test positive, then you cannot fly or you cannot travel, you cannot come back into work until 3 days after you've had a negative test. Okay, so we're starting to see, I'm seeing some of that start to happen, and it really kind of begs the question about the number of times a single patient is testing, and I'm noticing that the chart that we have on the board right now is number and percent of positive labs, not number and percent of positive patients. So can you speak to how much retesting we have going on, if any, or does this actually represent patients?
That's an individual that has tested positive once. If you get tested positive the second time, for whatever reason, it's not counted as another case. It's just one case. You get it once, basically.
Okay, because we do have people that, I mean, you say you test last week and you're positive, and you have to get, you got to get a negative before you can go back to work. So you go back in the next week and you test again, positive.
Yeah, it's not counted
You go at the
twice.
end of the week and get a third test, positive. That still shows up as one
Yeah,
on
'cause
this
it's-
chart.
It's a case. So the positive lab, the first time it's positive, correlates to a positive case. You could get tested 20 times more, all positive.
Yeah. So
One
this
case.
chart would be synonymous with saying number and percent of positive cases.
Number of cases, correct,
Thank you, sir.
yes.
That's all I have, Mr. Chairman.
Thank you. Dr. Lanza, do you have more slides?
Just sort of well, these are the curves that I send you every day. Spend time on it since you already have
Commissioner
them.
May?
When he's finished, I just didn't want you to forget me once he finishes the
Okay,
slides.
all right, thank you.
You go ahead, Dr. Lanza, and once you finish your slides.
Those are all from the surveillance,
Yeah,
that we provide a link to,
From
yeah.
the information I send you all daily.
Yeah, we provide a link to that every day.
So, but really, I guess Janice already talked about the CDC recommendations for masks. I just wanted to make sure that everyone knew that Dr. Rivke's, our State Surgeon General's recommendation, which was in a health advisory that he sent out last week. It says 2 July, it was really June 28th or something like that. All individuals in Florida should wear face coverings in any setting where social distancing is not possible, except for children under 2, individuals with specific medical conditions, respiratory issues basically, individuals obtaining certain services like dental services, for example, certain professions, singers, other sort of situations where you can't wear a mask. But otherwise, individuals engaged in outdoor work or recreation with social distancing, it's encouraged to wear a mask even in those situations, because you have the combination of the mask, of any type of mask, cloth, paper, or N95s, plus the social distancing, plus washing hands. All that adds up to improve or decrease the risk of you transmitting COVID, for one thing, and also receiving COVID and becoming sick with this particular disease. I can't emphasize that enough. It's that social responsibility of wearing a mask, social distancing, washing your hands. Don't go to work or school if you're sick. Stay home, stay away from people, stay away from large groups if there's no social distancing going on.
Thank you. Commissioner May?
Thank you, Mr. Chairman. Dr. Lanza, thank you so much. I know since March, these have been some long and difficult days. I can only imagine what you get on a daily basis. I know that I get 4 to 5 text messages or phone calls as it relates to COVID-19. So thank you and all our healthcare officials. I'm deeply indebted to your service, and I see your office on Gregory is next to my office. I see the work that you're doing at 6 in the morning, so I'm very grateful. But I do have a couple of questions. What is the turnaround time for right now with the DOH that you're on test results?
Right now, we're seeing 4 to 5 days on the tests that we're doing through MDL, the lab that we're allowed to use to do tests on.
Do you see yourself as increasing the rapid testing here in the future?
We have heard about that. We have heard the Department of Health has looked at that. They've talked about buying some of the rapid test units and bringing them down to the health departments, but I have not seen any physical equipment as yet.
Yeah, I mean, that was my question B. Why aren't we doing more rapid testing here? I mean, as Robert said, you can get in and out in 15 minutes. I mean, why wouldn't we be doing more rapid testing?
Got the result in 15, didn't get in and out.
Well, you got the results. Oh, well, that's even better.
They ran out of tests, yeah, gotta go back, you know?
Well, yeah, I mean, I did
Yeah,
the
the rapid
swab.
test is a kit.
Right.
And
Why wouldn't we do more
you
of them
can-
then? I
You
mean,
can have the physical machine, but you may not have the kits.
well, what would be
run it.
what would be the barrier? Is it money? I mean, we got 52 million that we could spend and help. I mean, is it money that's stopping you from doing this rapid testing for the citizens?
I don't know the answer to the rapid test question exactly. That would be something that the hospitals may be more aware of than us. I can just tell you that the Department of Health is looking at doing that. But once again, even if you have the machine, the Abbott machine, you have to have the kit. And the kit is in very significant demand right now across the world.
So the reason, and I'm just trying to be clear because I get these, as Commissioner Perry said, we have to answer these questions, and this is the only time that we can get these answers. The reason that we're not doing rapid testing is because we don't have the kit, we don't have the machine, because they're not available. Is that what we're saying?
Once again, I can only speak for the Department of Health. The Department of Health is looking into obtaining the machines and sending them to each health department to do the rapid tests, but there's a worldwide demand for these Abbott machines and the testing supplies for that. And so, you know, we work through the Department of Health. As soon as it's available through the Department of Health, they'll send it down to the health departments and the kits to do it, and then we'll be able to offer it, presumably at some point in the future. I would suggest in our calls with the hospitals, we ask them what their success has been in getting more of the machines and the kits here.
Right, I understand. And when you're talking about the contact tracking, were you able to tie any of it to Pensacola Beach or to high school graduations
No,
at all? So you didn't,
Not-
any of the graduations, so you didn't
not
tie?
in any of the contact tracing that we've done in the past couple of weeks. Since the high school graduations occurred, we haven't heard any situations where there was an epi-link between people who attended the graduations or were out on the beach. Now, just by that factor alone, now people don't just go to the beach, they don't just go to high school, they do other things too. They go to bars and other situations. So when we continue asking the questions, and yes, there have been people who've gone to the beach, went to the bar, tested positive, yes.
And you mentioned earlier to Commissioner Bagash that after 9 days, you are no longer contagious. Is that just for a mild case? Or, I mean, because I think I read the CDC daily, and I've read where up to 3 weeks, if it's severe cases, that a person could still be contagious in the hospital. Is that not true?
I can only go by what the
I know they
CDC,
said the mild case would be
yeah.
maybe 9, severe case would be 14. And if that is the case, I mean, if one of our employees, or say we have an outbreak in our jail, and so we have positives in our jail today, so how long should we quarantine inmates? For 9 days, 14 days? How long? I mean, do you recommend that it's no longer contagious?
Right. Well, definitely for 9 days and probably 14 days since they're not healthcare workers.
Nope. Okay.
And
9
I
or 14?
assume the jail
Not-
part.
I mean, because we're gonna have our jail director that's probably gonna talk a little bit, and we have employees that have come in contact here at the county. I mean,
Right.
and so, you know, employees, I mean, we had, ECAT had a scare, and, you know, people were recommended 5 days. I mean, you know, so what's your recommendation as a healthcare official? I mean, I'm not reading 9 from the Center for Disease Control, but you're saying 9 is okay.
I'm not sure what your question is.
Once a person comes in contact with a positive person with COVID-19, how many days should they go and quarantine themselves? 9 days, Commissioner?
14 days if they've come in high-level contact with someone who's COVID positive, unless they get tested and they test negative. I see what you're asking.
Yeah, I'm sorry.
Sure.
So you're recommending 14 days, correct?
If they are a high-level contact with someone who's documented COVID positive, it's 14 days, yes. That's
Okay,
correct.
and I just want to get that,
Right.
and the reason I'm doing this at this point, because you can tell by the five of us that there are a lot of questions, there's a lot of confusion, and so the average citizen can only sit at home and watch us question top healthcare official because people just don't know, and I think that clarity is important.
But Commissioner, as you said though, I mean, unless they get tested, so we were able to get all of those ECAT workers tested,
And they've all come back negative,
And they've all
only
come
the
back-
original one, yes, sir.
yeah.
Board, let me.
Right, but
I'm sorry, one second. Let me interject and ask for some feedback from y'all. We are 5 minutes until 11 right now, and what's your opinion on, we have Dr. Lanza's discussion, and we still have Chief Powell, Eric Gilmore, both, going to be talking to the board as well. We do have some people in the audience, I can guess, have something to do with something on the agenda. Do we want to just give feedback that we're going to, this discussion probably is going to run another 30 or 45 minutes, that we're going to break at 11:30, 11:45, and that we're just not going to necessarily have agenda review this morning, and we're just going to go into the board meeting tonight?
I think that's a
support
great
that.
suggestion, yeah.
yep, whatever you say, Mr. Chairman.
All right. And
Whatever
for-
whatever you're comfortable with,
Yeah.
Stephen, is what I support.
I don't want to try to rush this discussion, and I also don't want to keep y'all here for another 2.5 hours to go agenda review and then reconvene an hour later for public forum. So with that feedback, our guests in the audience, I appreciate y'all being here. I apologize, we have not gotten to agenda review. So we'll just go into public forum at 4:30 today, and then into the board meeting at 5:30 and take all the agenda items at that time. So I apologize, and we'll get back to this discussion. Commissioner May, you still have the floor.
Thank you, Mr. Chairman. And when you say high-level contact, what do you mean by high-level contact?
Right, hugging, kissing, sharing food.
Okay, so that would be considered
So basically, contact with
kissing.
someone, well, the basic category for a high level is greater than 15 minutes within 6 foot. But the moment you touch someone who's positive, that goes out, and then you become high level.
I just have like one or two more questions, Dr. Lanza. When we first started in March and when we initially set up those testing sites, and people say if the positive rate, we can be at 3%, 4%. So today we're at 19% positives. Does that alarm you at all? Should we be alarmed, or is it because we're getting more testing? Because, to give Grover's example of green, yellow, green, and red, in terms of what we do on our weekly calls about hospital beds. So at 19%, are we green, yellow, or red?
Right, but notice the ages in the 20s and 30s who have the least serious medical effects from the disease. So we're not seeing a large number of cases. There's only 4 people in our hospitals right now in the ICU on ventilators who have COVID. It's varied between 4 and 7 over the past 2 or 3 weeks. Really hasn't changed much at all. The numbers with
7
COVID
out of
vary
111.
13 to 25 a day in our ICUs, and 20 to 30 in non-ICU. So the hospitals feel that they can handle that apparently, and that's why they're saying that they're green, all 3 of them. They've never not been green, from what I can remember. So the issue comes when we have older people who have lots of underlying issues who end up in the hospital. And that's why the
Not only
primary
older people,
department-
but people with pre-existing conditions, and quite frankly, that's why it adversely affects people without health care and people in black and brown neighborhoods because of the health condition, the pre-existing conditions.
Yeah, in fact, the numbers that I didn't show you was that, I'm having trouble reading these things. African-American cases are 28% versus 49% for white, but the hospitalizations for African-Americans are 52% versus 43% for whites. 27% of the deaths have been African-American, 67% white. That's every day that I put
Right.
that information out every day.
Which, I mean, you know, and that's very alarming, but we know the correlation, I mean, with the health disparities that exist in our country, our state, and our county, and so that's why we have to be proactive. But with that, let me ask you just a candid, direct question. Is this virus becoming more contagious, less contagious, or mitigated, in your opinion?
Well, the idea is that we, through either active immunity, you catch the disease, or passive immunity, there's a vaccine, we get to about 80% of the population that has antibodies to this disease. That's what we would like to see, because that's where we have something called herd immunity, where so many people have the antibodies that it's unlikely that a person that doesn't have the antibodies is going to get the disease. We need to get to that point. That's somewhere around those numbers. I don't know what the exact number is. So I don't think it's becoming more contagious. I just think you have people who are not being socially responsible, who are not wearing masks, who are not social distancing, who are not washing their hands, who are going off to parties and having a good time, but unfortunately passing the disease around.
Right. And we can't legislate personal responsibility, I mean, on the individual, but what we can do is prioritize the public health and safety of our citizens, and to me, that becomes paramount responsibility upon taking the oath as an elected official. And so we do have this letter, and every position that I've taken has been the epidemiologist, public health, as yourself, the healthcare officials, community health. I've never, ever led without direction from those who are in the day-to-day fight, you know, on this virus. So we are in receipt of a letter dated June 30th from Mark Faulkner and Gay Nord and Don Rudolph and Sandra Smiley. Obviously, you didn't sign it. So my question to you, what is the public health position on masks? And because that is we know what the mayor and the city council and we know what the federal government is doing, but what's your position on that?
It's right there. That's Dr. Rivke's position, and that's public health position in the state of Florida.
That's your position. That's all I needed to know.
As
Thank you,
employee
Mr.
of the
Chairman.
Department of Health, that's our position.
I understand. I just wanted it for the record, sir. Thank you, Mr. Chairman.
Yep, Commissioner Bender.
Thank you, Mr. And Commissioner May, on that, I think that's our position as well. I mean, that's why we're doing this huge marketing campaign to show that people should be wearing masks. But I think it's
I wasn't
also.
questioning our position. I just was actually.
No, but that's what I'm saying. I think that's why we're following those same things. And Janice, I think you said we've included that in every one of our 151 times we put that out. I think we need to do a better job of telling the public why they need to do it, not just in public, but in small gatherings even, like a house party or something like that.
And we could do a better job. I mean, the bottom line is what he's saying. All individuals in Florida should wear face covering in any setting where social distancing is not possible.
Right.
Except for those exceptions.
Right.
And so we should promote that and support that if we're partners with our state agency.
Can I just say that in the past 3 weeks, we've received 11 pallets, each containing 22,000 of these Hanes cloth masks, these white ones. And we have distributed over 240,000 masks in the past 3 weeks to dozens of agencies in Escambia County.
I think, including, I think 20,000 to the beach hotels and businesses this week, right?
We've gotten it out to them as many as we had
Okay.
left. There's a
A large number.
backlog,
We'll just
huge
say a
backlog.
large number went out to the beach.
I know they bought 20 million. They're
Okay.
coming in at 5 million lots to the central place in Tallahassee and then making its way to us, or it's Orlando, I'm not sure which way they're getting it. So we've gotten, as I said, 242,000, we've gotten at least 240,000 out already.
And that's great, and that, you know, as we said, we have our lifeguards that can hand it to people if they
Sure,
need any,
sure.
so we appreciate that. But again, I think, I'm hoping the takeaway that the public gets from this discussion this morning is that the CDC, Escambia County, recommends and suggests that you should wear a face covering in any setting where social distancing is not possible. And I think the other thing is where we're seeing these cases. So as we said, you said, we're seeing it going back to bars. We were seeing it go back to restaurants. We were seeing it go back to places where people weren't following CDC guidelines. I think we're seeing that in the same thing with the cases that have been Escambia County employees that at some point in their timeline, they didn't follow the CDC guidelines either.
So, Commissioner, real quick, what I would anticipate, I mean, this has really been a work session for us to try to get, it as knowledged up as possible and everything. We do have a couple of items on the agenda tonight that are related to COVID issues, whether it be the CARES portion or maybe even more appropriately, the portion of the county attorney's report related to the extension of the Emergency Act, where, where whatever specifically mask discussion the board would have and an outcome in a discussion, I would really see being there rather than having somebody just try to take feedback from the discussion this morning, which I think everyone agrees with what you're saying. But I think that the takeaway is probably more appropriate to come from the meeting tonight than the meeting this morning. But
Understand, Mr. Chairman. Thank you.
Commissioner Underhill.
Thank you, Mr. Chairman. Dr. Lanz, I want to go back to a little bit about what we had discussed earlier, and don't want to do a back and forth on it, but reading from the CDC website, the number of positive tests in a state is not equal to the number of cases, as one person may be tested more than once. And that I think that's going to be very important as we put out data. Every single word that we put out on the screen is the government's word, and it needs to be exact. So if you could go back and kind of review your answer to that last question today, and let's re-engage on that tomorrow to make sure that what we put out is in fact that people perceive what they read is what we intend to say. Does that make sense?
CDC provides guidelines to all the states. In the state of Florida, you've had one positive COVID test. You could have 50 positive COVID tests after that. You've got one positive COVID test, and that is only the one that's reported.
Excellent, and that's exactly what you said in the previous statement. I need to make sure that what we're putting out, because what we said there was positive labs, that we need to clarify for people that what you just said is factual, so that people aren't inferring from that data something that's not factual. The point that I would like to get an answer on from you is really about the question of who should test. When we first began this and we were having a hard time getting people tested, we were having a hard time getting test kits, we recommended to people that unless you were symptomatic and or had recent contacts, you were in a high-risk type of environment, then you should not test. Only those people that were symptomatic and high risk should go and test. But it's a long-standing policy of public health policy to know your status. On the HIV discussion, of course, we spend a lot of advertisement money on know your status and trying to convince young people to be aware of their status with regard to STDs. That's a good policy, so I would ask, are we at a point now where everybody, since everybody could be an asymptomatic carrier, that everybody should be testing to the best of their, obviously not making it mandatory, but the last word that we put out was, unless you are a high-risk person, don't go test. What is the guidance that you're asking us to put out to the citizens now with regard to who should test?
Well, of course, it's an individual preference. If you're symptomatic, then I definitely suggest testing. If you just want to know, then I would suggest testing. But right now, what I put out in our press release every week is that we are in the phase of public health surveillance and monitoring. That's what we do. Sacred Heart, the hospitals at least do symptomatic based on their process, their survey process. UWF and Department of Health, I can't speak for UWF, but I can speak for Department of Health. We're looking at public surveillance and public health surveillance and monitoring. We just want to know what's going on out in the community. We'll test anyone.
Excellent. So your advice then is to anyone who wants to know what their status is, they should not hesitate, but go directly to one of our testing sites and get tested.
If that's what they want to do, yes.
Excellent. Thank you. I am glad to hear you say that, because I totally agree with that. I think every single person who has any interest in whether or not they are COVID positive and by their own will should go and get tested. Thank you.
Commissioner May.
Thank you, Mr. Chairman. Dr. Lenz, are there the pros and cons of wearing the mask? People with respiratory problems or any problems like that, are they recommended to also wear masks? Or is there a certain segment that you recommend that they don't wear masks?
Individuals with medical conditions, they have to with their physicians, assess as to what the situations they should.
And they should go be evaluated and not make that decision on their own. They should go into their primary care provider and get the
Well,
recommendation.
I think people should be responsible for themselves, so they should, as adults at least, be able to make that decision with the consultation of their physician, but it's up to the individual to make the final decision. Now, children, it's different, it's up to the parents.
All right. And as you stated earlier, you don't feel like you feel in terms of testing and positive, we're in the yellow and the mile. You don't feel green or red at this time. In terms of where we're, the 19% positive rate that we are you at all alarmed about that?
Well, of course. We are looking at why that is, and right now we're looking at the younger generation, especially the 15, 16 to 40-year-olds are where we're seeing most of the cases. 40% of the cases are in that age range because of the fact the bars are open. Not so much the restaurants, but the bars are open. They're having these parties, they're all getting together, and they're spreading the disease. So we're seeing that. We're also testing 3 times as much as we did a month ago.
And so in your forecast, I mean, if you're looking at a timetable, and when do you see us maybe making a turnaround and the numbers beginning to decline?
Hypothetical, I can't answer hypothetical.
All right. Well, you're a scientist. I respect that. In terms of community center programs, children playing sports, what's the recommendation for DOH on that? I mean,
Sure.
I know bars have closed down, but what about contact sports,
For
football, basketball, those type of things?
Right. For kids, we recommend for community centers, temperature checks, wearing a mask if their parents allow them to wear a mask, social distancing as best you possibly can.
Well, how would I
washing
wear the
hands
mask in
frequently.
like football or basketball? That would almost be impossible. So are you recommending that, is it safer? I'm a Little League coach, and I get that question more than anything. And we just had I don't see Michael Rose, we had a big meeting. It's probably not going to be feasible for football players to breathe, run, and have a mask underneath their helmet. So is it safe for children to go play football and basketball and come in contact right now, or should we wait before we start encouraging them to engage?
So then what you do is you do your best at social distancing, washing hands.
But in your opinion, it would be safe for us to begin, I mean, I think we got August 15th date. Do you feel comfortable in us engaging in contact sports such as football or lacrosse or basketball?
I think any activity which you can maintain social distancing, wear a mask if you can. Like if you're sitting on the bench, wear a mask. If you're out on the field, probably can't. I agree with that.
But I mean, we know in basketball, we will not have social distancing. The object of the game is to put pressure defense on the guy and get.
Understood.
Yeah. My defense would be social distance, but my boys would not be social distance because we get in their face and we get in their face very aggressively. So I mean, would I? And the reason I ask this is because I represent hundreds and hundreds of volunteer coaches. I've been doing this for 30 plus years, and so I probably have 1,000 coaches saying, Coach Lumen, how do we move forward? So I want to be able to give the best advice that I can as an elected official, as a commissioner, but as a coach, and saying, yeah, it's safe. My son plays basketball. Is it safe for children to be out playing basketball?
Well, there's risk in anything that we do, of course, but if you can maintain distancing as best you possibly can away from people, wear a mask when you're not out on the field, wash your hands frequently. I think we need to try to get back to as close to normalcy as we can with minimal risk.
Right. So again, and you're a pretty good politician there because you hadn't got me that directly yet. When we're playing basketball, football, is it recommended that they can play? I mean, because what happens is if a kid is playing in our community center and gets COVID-19, and then someone's going to be held responsible for that, and so they can't. I mean, I hear what you're saying. If they can maintain social distancing, I can't on a basketball court. It's not the object of the game. I can't maintain social distancing on the football field. People are going to sweat. They're going to get hit. Droplets are going to come out. We know that science. So what should we be and the reason I say this is because it is a very costly endeavor for these youth organizations in which we have to start pre-planning in July. I mean, to start playing in August or September. And obviously, we're going to look at the Florida High School Athletic Association and what they do. But from a health perspective, not just from a recreational perspective, from a health perspective, what do you say if we cannot maintain social distancing? I mean, we can do that in baseball. That's pretty common. We can do it in tennis. We can do it in golf. Unfortunately, the contact in team sports, we can't. So I would just like to get, your opinion as not as a coach, not as a
So
county
what-
commissioner, but as a public health official.
So where you develop the risk is less than 6 foot for greater than 15 minutes.
Oh.
So if you can work within that guideline, wear a mask when you're not out on the field, so to speak, wash hands frequently, temperature checks before they start the game. I mean, that would,
So pull him out the game every 15 minutes?
temperature checks before they
No,
start
you
the
said
game.
if durations of less than 15 minutes you feel like they're safer, is what you're saying.
The definition of a high-risk contact is greater than 15 minutes, less than 6 foot separation. So try to work within those guidelines as best as is possible and wear masks when they're not out on the field.
Okay. I'm good, Mr. Chairman. I've never got much more playing time than 15 minutes, so it's fine.
Yeah, that is,
Me neither.
Yeah, Robert, I don't know, did you get a lot of playing time or not?
that is,
Yeah.
that is quite a while. Dr. Lance, I have one question. You brought it up, part of the youth discussion. I've had some friends that have tried to get adolescents tested and tried to have adolescents tested.
Okay,
And have been
teenagers.
unable to do so. Do we have sites that, only certain sites that will test pediatric type ages?
My staff forgot. My site will test, we've had 3-month-old babies
Okay.
at the health departments. I think, I'm not sure.
UWF specifically
Is it
wouldn't test.
18 and above for UWF? Yeah. Yeah.
Okay, so we know that UWF is that, but the
But
Department
our
of Health.
site, I told them, they have to sign a consent, the parents have to sign a
Sure.
consent, of course, because they're under 18,
Okay.
for anyone. But yeah, our youngest, I think, was 3 months.
Have the other sites, like the Ascension, when they've been set up places, have they been testing people under 18? Does anybody have experience with that?
I think they
I believe
have
so.
if they meet the
'cause-
criteria.
I mean,
Yeah, I don't think-
mine
yeah,
tested,
they do.
but They could have gotten
They
tested.
could have?
Yeah.
They could have, Stephen. I
So-
know that I sent some people over to community health.
And
And I've sent families over to community health, children and the adults.
Okay, so do you think UWF is the state aspect of it? Is that,
I'm not sure why they have that
Okay.
limitation. I don't know why.
all right. Commissioner Underhill?
Thank you very much. Dr. Lanz, I mean, we make jokes about the politics aspect, and your job is precisely that point, right? Is the contact point between health and politics. And one of the things that I want to truly, I mean, I'll bash on you all the time when it's right, when I think that's the right thing to do, but I will tell you that I am very impressed with the fact that throughout this conversation today, you have answered almost every question with at least a nod toward individual responsibility. And that reflects our governor's guidance throughout this thing at the state level. Obviously, your boss, right? So, but in everything that you've said today, you continually bring it back to that individual responsibility, and that's why I'm really very impressed. I'm looking forward to these going out in my district, and really, it's our job to inform, but not necessarily to cajole and command. So I'm very much looking forward to that, and thank you very much for the mention with regard to the testing. From this point forward, I'm going to be telling everybody, exactly the same as we do with regard to the Know Your Status thing. And we'll be talking with my aide about, can we spend some of my discretionary money to talk to people that way and tell them, know your status. If you are, just like any other community health issue, you have a bit of an obligation, personal obligation, to know your status so that you don't unnecessarily put others at risk. And I want to thank you very much for taking the time. Your legs have got to be tired. You've been standing up there quite a while. And you have done a very good job, in my opinion, of answering the questions that we've thrown at you with really no preparation. So, a lot of people get to ride gently into retirement. You certainly have not been given that that opportunity. And again, thank you very much for your time today.
Thank you.
Dr.
Thank you.
Lanza, I'm sorry, I was just going to.
Go ahead. Yeah.
I do appreciate your time, and the questions that were presented to you from me are questions that my constituents ask me every day, so I appreciate you helping me to facilitate the answers. I mean, in my opinion, there's no question that we have alarming numbers in the state of Florida and alarming numbers in Escambia County, and this does cause for citizens to be alarmed and for you to be able to take the science and the data to give answers. It's very informative and appreciated by myself and certainly by those who are watching from home. that are very concerned about their health, because health disparities are a great concern. And I mean, I often say, Dr. Lands, it's old people dying in the nursing home until it's your mother or your grandmother, or it's a young person getting
Right.
it until they transfer it to